St. Luke's Hospital is in Jharkhand's Godda district. This district shares a border with Bihar state in central India. St. Luke's caters to poor and tribal communities from both these states. About 60,000 people sought care at St. Luke's in 2021 alone. And yet, grid-connected power supply has been a persistent challenge here.
Actually, the hospital was established in 1974. It was like a small dispensary managed by general nursing staff nurses. We had no doctor.
Dr. Mary says retaining medical staff, especially doctors, has been a challenge since the hospital's inception.
See, usually this area, generally people don't want to come from cities. Mainly facilities are not there, electricity problem is always there.
About a third of India's coal reserves are found in Jharkhand. The state is also home to nearly 50% of the mineral reserves of the country. Yet, the state has remained energy poor until recently. And despite its having achieved 100% household electrification, nearly 50% of life-saving services, such as public health facilities, have remained without electricity connection until the onset of COVID-19.
We take minimum charges from patient that it's not possible with that minimum charge to run the hospital round the clock with the generator. We have a generator, but it's not possible because general ward patient we just take 100 rupees per bed. So for that, with that 100 rupees, we are not able to manage the hospital with round the clock running the generator. Generator we use during OPD hours when we have some x-rays, all that we use. Otherwise night, always I have found it even to use the oxygen concentrator. It will actually require steady electricity. Also oxygen concentrators does not run with batteries. So when we have such kind of patient in the ward, we require even night to run the generator, which for us, like it is not affordable.
St. Luke's is located in the heart of Jharkhand's coal belt. Many patients come here with respiratory illnesses.
So when I heard about this solar thing, I thought, okay, at least if we get solar connection to the ward, we will be peaceful.
A partnership between WRI-India, HSBC India and CHAI enabled the setting up of a 10 kilowatt rooftop solar system in late 2021. This system now serves several areas of the hospital. The solar panels are attached to a battery storage system to ensure uninterrupted power supply because of the variability of solar energy. Staff at St. Luke's have been trained to clean these panels twice a day, as coal dust from the mines close by settle on the solar panels, reducing optimal power output.
Ground floor ward has fully managed by solar panel. Then we are also running the waiting shed of the patients with the solar panel, and the staff kitchen and the dining rooms are run by solar panel. After putting the solar, till now we have not found any problem those areas. To maintain the battery, we have entrusted, even to maintain the panel and the battery, we have entrusted one of the staffs.
Dr. Mary Lali would now like the whole hospital to be solarized. She says this would solve the challenges of unreliable power supply the hospital faces, which affects not only the patients but medical equipment as well.
We are happy to be associated with the project in Godda, Jharkhand, as it focuses on providing life-saving care in regions where public health care has been a challenge, particularly for poor and rural communities. What we realize is that solar power in these regions is not an alternative, it is a necessity. And we are happy to see positive outcomes with our partnership with WRI-India and CHAI.